Good morning. Today I am going to introduce you to Mrs. Bina. She underwent a knee replacement 6 years back and the stem cell treatment to her other knee, right knee, 2 years back. 2 years back. So now she has come. She was also a diabetic, and then she had some symptoms. She was confusing the other symptoms for probably residual pain from the stem cell done knee. With the total knee replacement leg, she has no problems at all. But stem cell, because it's a new thing, she was having all kinds of doubts whether that that stem cell is working or not. So I've examined her today, and then we have come to a conclusion, and I've explained to her. So on the basis of my examination and her own activities which she has done today, like walking, climbing stairs and all that, she will narrate her own experience. Over to her. What's your name, madam?
డాక్టర్ గారు నాకు బాగా ఆపరేషన్ చేశారు రైట్ నీ లెఫ్ట్ నీ
6 years back.
రైట్ నీ వచ్చి స్టెమ్ సెల్స్
ఎప్పుడు
ఇంజెక్షన్ 2 years back.
2 years back. 2 years back. ఇప్పుడు how are you?
I'm feeling nice, good.
That's the word.
Thumbs up
did you climb stairs? Paiki eftara?
Yes.
You can sit cross leg?
Not yet right.
You can. Okay.
Kneel down chesta.
Kneel down chestara? Very good. Madam, climb stairs.
మట్టుకోకుండా ఎక్కండి
భయం లేదు.
నెక్స్ట్ ఆపరేషన్ ఫ్రీ.
Come, madam. Leave that hand. Any pain?
No pain, but
Say again. What? Any pain while coming down?
let me see.
No. You say any pain while coming down?
No.
No pain?
No pain, no gain. Sorry, yes gain. No pain, yes gain.
Okay.
Doctor, this caption actually you can keep.
It's be your diabetes. How is it now?
It's in control. Yes.
BP.
BP is also in control.
So because of that, your knee is also under control.
Yes.
Okay. So now today I have told you certain things which you should be very strict about. Okay. Avoid sugar. Eat early. Eat lot of fruits. Eat lot of nuts. Avoid fruits. But if you want to have a nice drink, then don't have a Campa Cola and thumbs up and all that. Have a Matcha tea. What is this Matcha tea? This is a new thing on the internet nowadays. You Google. Your daughter will Google. Matcha tea is the best tea. It's known to improve diabetes.
Lemon tea, Japan.
No. Matcha is a green tea. Okay, this is the latest thing. Flavonols, lot of flavonols are there. So you can add some artificial sweetener to it. Have that. Fantastic, good for your health. Matcha tea, and then early diet. Avoid carbohydrates. Protein, you said you are taking 100 grams. Keep taking 100 grams. Olive oil, vegetables. Finish your meals by 1 o'clock. Now the latest theory about knee pain is that it is not related to age and all that. And it doesn't need knee replacement. For example, you are an example now. In your case, left knee you had a replacement, but that was in the days of ancient days, prehistoric days.
You can make one book, doctor, telling this only. Actually, they will make a documentary.
But now, modern age, the stem cell treatment. See,
is it good, doctor?
You see, ask your mother.
Yes, but
You don't ask me, ask your mother.
Okay.
What is it?
Asking others is very easy than mother. Anything.
No, your mother's is she complaining of any knee pain? No knee pain. So that's the answer.
Okay.
Why look anywhere? Got an example in your own family.
Okay.
That's it. And then you share this experience with other people. and through this video you are going to share it with other people.
Okay, doctor.
That's what, first-hand evidence. Directly you are seeing your mother. And are you convinced that it is working? It's working.
Yes.
Okay. So nothing to worry about. You are doing well. Now I made further improvements in that. Yesterday also a patient came. You can see my YouTube channel. I have started giving patients alcohol ablation of nerve from the knee.
Okay.
So in addition to the stem cell with which everybody is good, sometimes they complain in the initial stages. So I inject alcohol into around the nerves in the knee joint.
Okay.
So what alcohol does, alcohol knocks you off.
Oh, yes.
So it will knock off the nerves also.
Okay.
No pain. This is the latest.
Okay.
So do well, ma. Thank you. And then next time when you come, your sugar and everything. Today I've written some tests for you.
Yeah.
Kindly do all that and let me know by WhatsApp, not WhatsApp, by email. I don't carry WhatsApp. I don't see reports on WhatsApp.
Mail me.
Kindly mail me. My mail, you don't have to ask me. It is there on my website. You have seen my website.
Yes.
And you have seen my Google.
Down you keep your mail ID.
It is
Dr. Venkat
joints at gmail.
Gmail. That's it. They will see that one.
Yeah.
No WhatsApp.
No WhatsApp.
People will go for the mail ID. Definitely they will go. If they want to approach someone, want to approach you, they will see your mail ID. Actually, outside people, they will always mail. They don't do WhatsApps and all. Then it's better you keep your mail ID under your name, Dr. Venkat joins at the rate Gmail. People will see, and it will be also catchy also. That is easy also. Venkat joins. That's it, right? Easy also. Catchy. That is no problem.
Okay. So thanks for coming all the way from such a distance.
Nellore.
I'm from Nellore. Yes, you have come from
Andhra
Nellore.
Pradesh.
And from Andhra, you have come past Madras into the next district,
Yes.
Chengalpet district.
Chengalpet.
I'm in Mandalore nowadays.
Okay, we have to go to our aunt's.
You have to go to your aunt's place.
Okay, bye.
Bye. Thank you.
Thank you, sir.